April is Parkinson's Awareness Month. Right now, an estimated 1 million people in the U.S. are living with a neurological disorder, and about 90,000 new cases are diagnosed each year. That is according to the Parkinson's Foundation. However, health experts say early symptoms of Parkinson's may be subtle and are often missed. Tonight, Jeremiah Jacobson has the warning signs that everyone should know.
Behind Alzheimer's disease, it's the second most common neurodegenerative disorder in the U.S. Parkinson's disease affects the central nervous system, causing people to have difficulty controlling their bodies, and it worsens over time.
We actually lose about 80 to 90% of our cells, these cells, what we call dopaminergic cells, before we even notice the symptoms of this disease.
Dr. Sanjit Grewal with Mayo Clinic says one of the earliest signs can be a slight tremor or shakiness, sometimes in your thumb, index finger, or chin.
One thing that's important to know with Parkinson's is often it's asymmetric, which means it starts with symptoms on one side and then can develop to having symptoms on both sides.
In addition, other warning signs include stiffness, difficulty with movement, freezing of gait, where a person has a hard time starting to walk, a face that has become expressionless, the person can no longer show emotions. Speech may become softer, and writing may start to look smaller. There may also be a sleep disorder that develops,
where patients will start acting out their dreams and they'll start to get very, very physical in their dreams.
Grewal says patients may also develop a stooped posture, like they're leaning forward. There may be blood pressure issues, a persistent loss of the sense of smell, and dizziness when the person stands up. Constipation may also be a problem.
We can catch it early, we can treat it early.
Right now, there's no cure for Parkinson's disease, but doctors say aerobic exercise may actually slow the onset of symptoms and improve quality of life. Meanwhile, the National Institutes of Health say there are certain risk factors that make it more likely for a person to develop the disease. For example, if a person has a family history of Parkinson's, is over the age of 60, was exposed to some environmental factors like certain pesticides, or experienced head trauma. Doctors also say men are more likely to develop the disease.